Hi, everybody. I'm seeing folks come on in here. It's great to see you all and have you here today. We're going to get started in just a couple minutes. I'm just enjoying seeing all these names that I recognize. It's wonderful to have our previous attendees back and seeing some new names in there as well. It's just really great to have you all here today. So it's 2:30, so I think we might as well get the ball rolling here, get started. Hello and welcome to our third mentoring webinar to help you either start or enhance your peer-to-peer CNA mentoring program. With us today is Janice Mashak, the Vice President of Member Services and Innovation with Leading Age. We have Robin Olsenberg, the Director of Housing and Clinical Services at Leading Age Wisconsin. Travis Miller, our Customer Service Specialist and Dynamo. And last but not least, Natalie Knopp, our mentoring expert, who's here to share her knowledge, wisdom, and experience on how to create a really great peer-to-peer mentorship program. So without any further ado, I'll hand it over to Natalie. Natalie, thank you so much for being here. Can't wait to hear everything you have to say.
Great. Thank you so much, Kate, for the warm introduction. And thank you everyone for joining us today. The audience for today's webinar is for the community's leadership team to understand the fundamentals of the mentor program for internal community support, as well as the mentor champion, the lead within the community to set systems for the foundation to support and oversee the mentor program. During our time together today, I'll be sharing more information about the mentorship program implementation at your community to now include CNA competency or skill stations taught within your community after the mentor trained the training. So next slide. Thank you, Kate. As a refresher, June 28th, during the Phase 1 webinar, for those of you that joined us, we focused on implementing the program within your community, preparing for the mentorship training. Train the trainer, with me sharing why a mentor program at your community, an overview of the program systems to set up for the implementation, such as the budget, expectations within the community, incorporating into clinical orientation, the mentorship program, bonus spreadsheet tracking tool, how to celebrate your new mentors, along with the policy, collecting statistics, identifying mentor candidates, this being a formal process with the mentor application, and preparing mentors for that education workbook packet. And then during our July 7th webinar, Phase 2, we focused on the nuts and bolts for sustainability, success and longevity of the program, giving the overview of the Train the Trainer Day with the didactic webinar training that Pat and I will be teaching tomorrow, July 13th from 8 to noon. We are super excited for this opportunity. You're gonna love it. We followed the competency and skills training in the afternoon once this is taught within your community by your team. We also talked about a supply list for the competencies, a sampling of the competencies, setting celebrations, mentor payments, a system for sustainability, and the steps for success. If you were not able to make it to our 2 prior webinars, don't worry. We'll be providing information on how you can access webinar recordings, the presentation slides, and materials that you can use to get started with your new or improved peer-to-peer CNA mentorship program. The folder is not password protected, just so you're aware. So please do not distribute the link or materials outside the Wisconsin long-term care community. All right, we'll get started for today. During our time, we're going to share how to plan and implement the afternoon CNA competency completion skills within your community, which follows the 4-hour didactic Train the Trainer mentor training. It's always such a mouthful when taught at your community by your mentor champ. So if you could, next slide, please. The mentor program, and I know I keep repeating this, but this is really important, is a community-based, self-supporting program that allows for the mentor champion who will have all the tools and education to onboard the new CNA mentors at any time within your community. I think that's one of the most beneficial parts of this program is that you, the mentor champ, can train this training at any time that you see fit. The CNA mentors onboard new CNAs upon hire, and the mentor program is intended to be an extension of your clinical orientation for CNAs. Once communities have attended tomorrow's Mentor Train the Trainer training, you will be ready to implement and celebrate the new CNA Mentor program within your community, what we've been working for. At your community, the flow for the Mentor Champ is to train the new CNA mentors at any time with the 4-hour didactic training in the morning, followed by lunch for your CNAs, while your clinical leadership team set up for competency completion stations in the afternoon. Once you have the CNA mentors, they can also help set up and teach your community stations in the afternoon. So first chat question, yes or no? Won't it be awesome to have mentors that can help you set up and teach your competency stations in the afternoon? I would think everybody would say yes to that in the chat. So yes or no? Remember train for the new mentors so that you have a deep reservoir in every neighborhood for every shift. You will want to train at your community potentially biannually, depending on your community's attrition rate. Next, we're going to go through the flow prior to and during the day of mentor training once this is taught at your community. All right, next slide. First, you're going to prepare for the number of new CNA mentors being trained, putting together a roster with their name, phone number, and email to send information about training day. It's essential for your new CNA mentor trainees to know the specifics on training day, such as a reminder to start, on the start and end time, where to park, what the day's time schedule looks like. Is lunch being provided, or do they need to bring one? An address if this isn't held at your community, such as at the corporate office. For us, we dress casually to make this more relaxing of a day, and there's a lot of movement in the afternoon with practicing the skills. Remind everyone to be sure to wear a name tag so that everyone feels comfortable getting to know each other and using their first names. Finally, give the mentor champs contact number to your trainees. What we have found is things happen, life happens, right? Sometimes someone will have a flat tire getting to the training. They run into traffic, they get lost, especially if it's hosted at a different site. So make sure to give that phone number, a contact phone number. This really helps to set the expectations and decrease anxiety. Mentor prep for the mentor train the training sheet also helps the mentor champ prepare for the number of training packets and competencies or the skill packets to be printed and ready for the day of training. So we'll be sharing more about this on the next slides. The mentor champ will also need the names of a few nurses that will be helping set up lunch, the skills competency stations, and help teach competencies in the afternoon. Once you have CNA mentors, again, those mentors can help prepare the lunch for the trainees. They can set up the skills and competency stations, and they can help teach the competencies. Remember, this is an elevated role seen as a leadership position within your community with top level buy-in. It's our goal, in part, for retention and exceptional care for our residents, and having really strong mentors is a way to be successful. All right, next slide. We shared in phase 1, implementing the program in your community, the need to prepare the mentor training packets for the day of training. Each attendee receives a pre-printed training packet The packets have documents that will need to be printed and assembled for each of your new mentors to have during the mentor training, and also to be able to take home as a reference to the training. The packets contain the PowerPoint presentation in the right pocket, with the left pocket holding the Mentor Champ's business card with contact information. You'll really want to make sure that those new mentors feel comfortable asking any future questions that may come up. So make sure that you give them a contact name so that they can ask questions at any time when something arises. The left pocket also has educational material that you want to print for you and your team's training tomorrow. The next slide we'll share has all the contents of the left pocket, and the link for the materials folder is on this slide. Oh, thank you. And that should be available later this afternoon. Next slide.
Sure.
Oh, yes.
We have a question from the audience here.
Oh, love it. Yes, please.
So the question is, so is the day that this is happening on, like this mentor training, is this on like once they're hired? She goes, is it after their regular training, or once they are hired, or during on-site training? So I think the question is more like when do you slot this into your overall, because you mentioned how it's like overarching orientation. So like where does this slot in?
Okay, yeah, that's a great question. So for us, the way that this is tied into clinical orientation is the mentors will onboard the new CNAs, the new mentees. We call them mentees. So your mentors will onboard your new CNAs by teaching them all the skills that they need on the floor. So during the 3 12-hour shifts, this is how we do it, 3 12-hour shifts or 4 8-hour shifts. And during that time, the mentors are going to be teaching your new CNA mentees all of the competencies as well. So that's how we tie in clinical orientation, is the competencies for clinical orientation are taught by your mentors while they're shadowing your mentor on the floor. And so for your mentor training, you'll want to identify your CNAs that are just really exceptional at your community. They love to train others. They're extremely friendly. They're helpful. They're knowledgeable about their skills and how to perform their job. And they love their residents, and they exemplify everything that your community has to offer. Now, somebody does not have to be super proficient on skills. Just so you're aware, what we have found is if somebody has the heart to be a mentor, we can certainly train them on the skills part. So once you have gone through the mentor, train the trainer training tomorrow, you will be ready to implement the mentor program within your community. So identify those exceptional CNAs that you would like to be mentors, and you will teach them the mentor training that we're going to be doing tomorrow. Did that answer the question?
I think so. So just to clarify, so
yeah,
this mentor train the trainer training occurs right prior to the mentee's first day, or 3 to 4 days after their first day?
Oh, okay. So your new CNA mentees will not be going through this training. They don't have the skills, nor have they been working at your community long enough to be a mentor. This training is only for your mentors, your CNAs that are seasoned, that are already working with you, that are already exceptional, that you want to be training and onboarding your new CNAs.
Okay, so the mentors are trained prior to the trainee's first day
That's correct.
on how to be a mentor. And
Correct.
then so right now that's kind of what you're providing the overview for. And then when you do the skills competency clinic or check, that happens after the trainee or the new CNA has completed 3 12-hour shifts or 4 8-hour shifts.
That is during that time. So yeah, so your new CNA mentee is shadowing the mentor who is training the new CNA to be at the community. So they're teaching them their job. They're shadowing them essentially. And during that shadowing time for your new CNA just starting, the mentor is also training on the competencies or the skills that they need to perform at the community.
Okay, thank you.
Did that answer the question?
I think so. Amy, if you need further clarification, will you please type it into the Q&A box? And thank you so much for your question. I think that was really helpful.
Yes. Yeah, very helpful. So we're talking about 2 different things. We're talking about training your mentors, who are the trainers of your new CNAs when they onboard. That's what this is. Yeah. So the left pocket contents, if you have a time edit slip, add that as your first document. And then you will also want to have the following printed in the order for mentor training day. So you will notice that some of these documents have been reviewed during previous webinars. Pat and I will go through all these documents during tomorrow's mentor train the training. So we'll go through the mentor program policy, the suggested onboarding, the mentee feel comfortable the first day, the mentor bonus payroll CNA, the new mentee evaluation form, new mentor evaluation form, the early warning concerns of the mentee, the mentor training for goodness sake book, mentor personal styles questions, mentor team building styles, and the mentor training participant evaluation. All right, next slide. Now that you have a list of all your CNA mentors, trainees, with their packets printed, you're ready for the didactic education in the morning with the goal to prepare for your new mentor for their elevated status and role within the community. This same education is taught to you, the mentor champ, and the community leadership team tomorrow, again from 8 to noon, in preparation for the mentor champ to teach at your community at any time. It's important for the mentor champ and the community leadership to experience the same training to support the program's longevity and success. So put into the chat, who is attending the mentor train the training at your community tomorrow? So if you could just enter that into the chat, want to kind of get a pulse of what that's looking like. Me, I see that popping up, Julia. Yay. All right, who else? Who else is attending the mentorship training, train the trainer training tomorrow? Oh, it looks like we have some responses, Kate, is that right? Donna Thompson, I just saw pop up from Brookside. Nice.
Yeah, we have Brittany saying that she's also going to be attending on behalf of her organization.
Great.
Victoria, and then we've got Rita, Amber, Kelsey, Alicia, and Sierra attending from another one. And we have a question: what if we don't have someone that can train tomorrow? Will there be a recording of this? Yes, there will be, and we'll put that up into the online folder.
Great, thank you, Kate.
Welcome.
All right. What's that?
Next slide, or are we still on this one?
Still on this one. All right, perfect. So when taught at your community, the didactic education's in the morning with the competencies after lunch in the afternoon. This training is really fun. It's super interactive. It's an informative class taught in an adult learning style. During the training, as a reminder, you will learn the definition of the program, what is a mentor, the process, and why it's important. Communication, as it plays an important role in everyday life and helps each of us develop supporting relationships. We'll discuss how communication takes place, the essential parts of communication, and how to develop good communication skills. Leadership is a skill, and the CNA mentor is in a leadership role seen as an influencer by your peers and others within the community. We'll discuss values, characteristics of leadership styles, and problem solving. We'll be talking about managing stress and time, sharing what stress is, real versus non-real, perceived and physical symptoms with the stages for your CNA mentors to recognize stress and have strategies to manage their stress and decrease burnout and help with time management. Pat and I will be reviewing work performance strategies to help your new CNA mentors succeed in their new role. And then we'll explore what your mentee needs to feel comfortable the first day and throughout their critical retention time of 1 year and beyond. So in the chat, if you know it, what is your current retention rate? And if you don't know it offhand, just maybe kind of guess based on how often you're seeing that you have open positions and hiring and rehiring and trying to fill vacancies on the floor. So in the chat, what is your current retention rate? Looks like someone had shared 50%, and that's not uncommon, especially right now with the pandemic. That is not uncommon. Any others? Any others know your retention rate? All right, well, if you don't know offhand, just kind of give it a number in your head and then close your eyes. So everyone close your eyes. And visualize how would it feel to increase your retention by 20% or 30%. I can visualize your smiles right now. Wouldn't that feel just completely amazing to turn that 50% to a 70 or an 80% retention rate? Imagine how impactful that would be in resident care. The heart of everything that we do. So great. As we know, adults learn differently than children, and our learning styles are diverse in part based on personal experiences. So we're going to discover 4 different adult learning styles in addition to transformational learning fundamentals with its 3 stages. And then changes of role we are always experiencing, including you as our mentor champs right now. So we'll explore the journey, define change and transition with a model of change, and the mentor being a change agent with the new rewarding elevated role within the community. And then finally, team building. It's essential for community success by working together through cooperation and coordination with one another to accomplish a common goal. We'll have fun exploring interdepartmental teams, team building strategies, values, and the benefits of having a strong team with 4 team building styles. All right, next slide. Our great team building activity is working together to prepare for the competency skill stations in the afternoon to accomplish a common purpose. Again, training with the same skills, step by step, the right way every time. All right, so something else to go into the chat, and I'm going to confess. So I know I have been guilty, and I'm not proud to share this, But when I was on the floor, sometimes I would take shortcuts, I would hurry through tasks, and I have picked up some bad habits. And some of those bad habits were from those that had trained me on the floor. So in the chat, has anyone else done this or seen this with our seasoned CNAs? They're taking shortcuts, they're hurrying up through tasks, they're picking up bad habits from those that have trained them in the past. Anybody else experience that? Oh, good, I see a yes. I'm so glad I'm not the only one. Yes, yeah, yep. All right, I am not the only one. I'm happy to feel that, but it is unfortunate, and it is true. It is true. So competencies in the afternoon give your new mentors, and when you have mentors teaching the afternoon skill stations to your next cohorts, it's an opportunity and a refresher to practice reading through, demonstrating, teaching other peers with feedback to gain confidence in knowing how to teach their new CNA mentees to accomplish the skills the correct way. At CLC, we use a combination of our nurses and CNA mentors to set up the stations while the mentor trainees are eating lunch for competency stations to begin at 1 o'clock. So I want to highlight at the top of this picture is two of our rock stars among many. This is Isabel and Seren. They have been mentors for probably 9 years, which is awesome. And they help with setup, teaching, tear down at every training, mentor training. Notice Seren's name badge. You're going to see that he has the mentor ribbon and the pen. And if you attended the session last time during phase 2, I shared with you that we had to shop around having a different mentor pen because some of the mentors didn't think that the pen was large enough. And Seren was one of them. Isn't that just awesome? He wears it with pride. I just love that. So you too are going to have some amazing rock star mentors. It's such a great opportunity for your CNAs. All right, next slide. Our great team building activity is, oh, sorry, that was that last one. You're good, Kate. I was not. This is an example of a hand hygiene competency that will be that we complete during our skills education in the afternoon. So in the chat, what is your state's #1 tag? And then I'll share with you what Colorado's #1 tag is. What is your #1 tag during survey? Or maybe within the top 3. I'll give you a hint. It has to do with our hand hygiene competency. Does anybody know? Infection control. Yep. That's ours too. Thank you, Donna. Yeah, that's ours as well. Anybody else have a guess? What is your #1 tag during state survey? Well, Donna guessed yours probably correctly, and it is ours as well. It's the F880 infection prevention. So hand hygiene, it's, as we know, it's the low-hanging fruit for our surveyors. It's really easy to identify when someone hasn't performed hand hygiene for 20 seconds or used a paper towel to turn off the water or hasn't completed hand hygiene in between resident tasks. So we complete this competency with every training opportunity that we have to try to combat that super easy tag to get. So each of your new CNAs, while enrolled in the CNA certificate class, will be provided written skills with step-by-step instructions on how to be performing their skills during their in-person lab training to prepare to take and pass the Wisconsin State CNA certification exam. So either use the written skills the student is provided and/or transfer the steps to perform the skill onto the blank template provided in the materials folder. Simply add your logo, the name of the skill at the top and the bottom, along with the steps. The blank template also allows you to add the verbiage your community uses. So for example, for us, we don't say facility, but we say community. Or a rehab patient from the greater community hospital is our guest. And for those that live within our community visiting our short-term rehab, they are referred to as our residents. So it really allows you to use the verbiage and the language that exemplifies the culture within your community. It is essential that during mentor training, the new mentor demonstrates or reads through each competency to prepare them to know each step of the competency. Reviewing every competency allows for consistency with all CNA associates performing the skill the same way and to feel comfortable teaching others the competency. And then also just being able to answer questions by listening to their peers' questions and for them to be able to answer or ask questions. Knowing how to teach and perform each competency correctly every time will also alleviate the fear and stress during survey because all mentors are teaching new CNAs the correct way to perform competencies without shortcuts, and everyone follows the correct way to perform a skill. One doesn't have to think about, is this the correct way? Because they're already doing it the correct way all the time, so it's now a habit. The mentor program offers new CNAs 2 layers to learn skill competencies in the classroom during orientation and with the elders at the bedside with a mentor. So during mentor training at your community, the new mentor will have 2 copies of the competencies. Remember, you're going to have those packets, and then you're also going to have 2 copies of your set of competencies. One is for the new mentor to refer to while teaching the new mentee, and the other is to be signed by the mentor champ for their employee file, retained for the supervisor for survey readiness. So the mentor champ is going to make sure during the afternoon skills session that all those competencies are signed by the new mentor and whoever is teaching that skill, so that you have a complete file of all the competencies to be survey ready. Remember how the mentors also ensure new mentees complete the competencies during orientation? So that's what we were talking about just a few minutes ago. Your CNA mentors that are training your new CNAs that are starting at your community will be going through the same competencies that they are learning during the competency skills in the afternoon, so that they feel confident and they know how to teach. The competencies that are completed with the mentor while paired up during that 3 12-hour or the 4 8-hour shifts and throughout the month will be completed. Many state mandates competencies or skills be completed within the first 30 days of hire. It is essential the hiring manager keeps that file again for all associates containing their competencies and other completed education. Competencies are extremely important as proof if needed for an adverse event, litigations, questions, or state survey, with signatures from the mentor and the new associate stating that they are competent in the particular skill. Mentor champions oversee the competencies, paperwork, and mentor payment. All right, next slide. We have found setting up the following 7 stations to be really successful during our mentor training skills in the afternoon from 1 to 4:30. So we have a check-in and check-out station. I've listed all of the items that we use during that we use to set up our stations. So we have a sign in and out table. We have a sign in and out sheet. Of course, pens being available. Pens with the pandemic, we now have clean pens and used pens, and then make sure to have your alcohol-based hand rub, or excuse me, wipes, the disinfectant wipes, to wipe down those pens that are dirty, have been used. We have 6 to 8 tables for the competency stations, chairs available for everyone to sit at. We have trash cans by the vital signs and the ADL stations. We provide we provide a light breakfast, we provide lunch, and then snacks, which are optional. We do have a coffee and water station available, alcohol-based hand rub for when the individuals first come in, and disinfectant wipes. The vital signs station, we have, if you have the vital signs rolling cart, have that available. Or if you use the stethoscope, blood pressure cuff, thermometer, pulse ox, have that available. So whatever vital signs equipment you typically use at your community, have that available, along with a box of alcohol wipes. At the ADL station, we will have a mannequin, if possible, have male, female interchangeable parts to demonstrate Foley and peri-care, the bed bath, repositioning. Make sure to have a gown so that we provide dignity to our mannequin to replicate giving that dignity to our residents, and they can practice that. If you have a bed available, have sheets, chucks, pads, towels, waterproof barriers. You're going to want drapes, sheets, and a bath blanket, boxes of different size disposable gloves, washcloths for perineal care, Foley, bed bath, etc., moisture cream or skin protectant products. These can be empty bottles just to show the process, just to practice. And then blankets or sheets for, again, that dignity, repositioning, pillows, support devices to practice repositioning, a basin for the bed bath and peri-care, toothbrush, Emerson basis, dentures, denture cup, denture brush or toothbrush, elastic stockings or those TED hose, topical medications. Again, it could be an empty bottle just to show that process. Grooming supplies, if possible, a disposable shaver, and then we keep that blade protector in place, and we actually use tape to tape it in place so that no one could potentially get cut. A scale, warm and cold compresses, Foley catheter care, and bowel and bladder and bedpan and output station. So at that station, we have the Foley catheter and the drainage tube, collection bag and emptying spout, catheter draining bag, a graduate, chucks, pads, and washcloths, and bedpan and tissue. For the oxygen station, sometimes what we do is we will ask our preferred providers or those that come into our communities often providing hospice or palliative care, if they wouldn't mind completing the training and setting up the oxygen supplies. So just so you're aware, you can ask your preferred providers or the providers that you work with often to also help with the training. An oxygen portable tank for PPE, the face shield, apron if used in the community, heavy duty gloves, optional earplugs, and nasal cannula. For the hand hygiene station and infection prevention station, we have a sink available to demonstrate the hand washing with soap, paper towels. You could also use a glow germ gel if that has been really effective. It really highlights where individuals do not perform good hand hygiene. PPE, donning and doffing for isolation, the gown, the clinical mask, or N95 respirator, eye protection such as goggles, face shield, box of disposable gloves, again, that alcohol-based hand rub, and a trash can. For the mechanical lift station, if it's supported within your community, we do have a Hoyer lift. So we will train on the Hoyer lift, sit to stand lift, if it's again supported in the community, gait belts, a wheelchair with the footrests and stand and pivot transfers for stand and pivot transfers, and non-skid footwear. There are some competencies that you're not going to be able to accomplish within those stations. So we do have a verbal station that is set up as well. And what we do is all steps are reviewed verbally, and we have question and answer, and that way they can get familiar with those competencies. All right, next slide. Does anyone have any questions on setting up the competency stations for the competencies? Okay, once you do it once, you'll get the hang of it, and it's really simple and it's super fun, actually. Everybody really likes going through the competency stations. So your skills and competency training can be held in a large room, a few empty resident rooms, or a makeshift lab with your station set up. We have Kelly, our androgynous dummy that can be either male or female, depending on the skills being taught. Depending on your budget, you can either purchase a blow-up dummy for around $125 or a larger dummy for around $1,000 and up. All right, so funny story. So I'm going through the airport security, and with blow up Kelly in my carry-on bag. And I received the weirdest disapproving look from the security agent ever as my bag is going through the x-ray. And how do you quickly explain, I'm a nurse, this is for teaching? Oh my gosh, I think I turned bright red. If you do have a blow up dummy that you use, do get an electric pump. Otherwise, you are going to be out of breath blowing up your Kelly. Oh my gosh, that was the other mistake I made. I went to another state. I brought, of course, my blow up dummy through the airport, and I didn't even think about an electric pump. And it took me forever to blow up our Kelly. Oh my gosh, and I was so out of breath. Oh, so quick question for the chat. What time frame do you think this training was based on our masks? I know everybody's going to get this right. What time frame do you think this training was? When were these photos taken? Well, you tell me, when do you think these photos were taken based on all of us being masked up? Yep, during COVID. Yeah. Yep, thank you, Donna. This was when restrictions had been a little bit lifted. We did not have active COVID in our community, and we were able to not have to socially distance, but we did still have to mask up. And so I encourage you to take pictures during your trainings and your education. It will be a good reminder of where you've been, where you're going, and the end goal. And when I was taking these pictures or had these pictures taken, I didn't even think about it. And then I look back through, and gosh, it just really, it warms my heart that we were able to do training during COVID within the guidelines that we were given. So good reminders. In 20 years, we'll all be laughing, right? All right, so it is our tradition. Oh, next page, sorry, Kate. It is our tradition to take pictures of our new CNA mentor cohorts. We welcome our new mentors while celebrating their growth. And we celebrate, again, with mentor pins, certificates, ribbons. Again, resources on ordering those optional mentor pins and ribbons are provided in your material. I highly suggest it. Set up a celebration to pin your new mentors in front of their peers, possibly again during that staff meeting, as this is a really celebrated role within your community and within your organization. You are spending your time and resources right now to start this program, and you want it to be successful and have the longevity that it really requires. So celebrate, celebrate, celebrate. Also, celebration it gives hope to your new CNAs that are starting within your organization that there's a career ladder. They can grow. They can be celebrated at some point with being a new mentor. All right, next slide. So continue the steps for success within your community. Identify your community champion, which you've already done. If your champion is moving on to start a different career path or a different organization, start to think of a replacement to train them with the current mentor champ for a smooth transition. We don't want to think about our mentor champ leaving our community, but we all know with attrition it can happen, so think ahead. Leadership, continue to support the mentor program and your mentor champ. Determine and secure that budget if adding an additional compensation other than that $500 bonus from the grant. If not this year, think about next year's budget. Think about how to set aside time for the mentor champ to complete paperwork and clerical systems, gather CNA competencies or skill station supplies using the list provided in the resource folder that we just went over. Remember too that you can use expired, open, used but clean items for your training. So have a special box set aside where those items can be placed into a box and you can use those for training. Integrate your clinical orientation into the mentor program. If this is an extension, again, of your CNA orientation. After tomorrow's mentor train the trainer training, your community will have all the tools to develop a sustainable mentor training within your community. Identify and train your mentor champ and leadership during tomorrow's train the trainer training. This training is also the same training that the mentor champ is going to use at the community when you train your CNAs to become mentors. Continue setting systems outlined in phase 1 and 2 trainings for a successful rollout of the program. Again, those are available to you, the recordings are. Ongoing reinforcement to continue the excitement to recruit additional exceptional CNAs to become mentors at some point as a leadership role within your communities. This can really help to retain your new CNAs. It gives them something to look forward to within your community. It's a growth opportunity. And then celebrate as a community. Everyone appreciates retention, especially your residents with that continuity of care. You have limitless possibilities within your community. It's a really fun, exciting new adventure that you're going through. All right, next slide. So thank you for joining me today. Join me again tomorrow. We have the mentor train the trainer training from 8 to noon. And then July 21st, we also have a Q&A session so that once you've gone through the full program, all of the education, if you have any questions, we can help support you and answer those questions. So we do have a few minutes left, 10 minutes left. I do want to find out, does anyone have any additional questions? Any clarification? I know there's a lot of material and a lot of information, so I want to be mindful to make sure to answer anything that you may have.
I don't see any coming in yet, but I did think of a question based on one of the photos that you showed, actually, with the group of all the mentors being trained at the same time.
Yes.
Does that mean that all the mentees start on the same day or in a cohort, or like how does the mentor training, like you have like a little group of trainer mentors that you're training, how does that then get connected to the new mentees that are starting?
Oh, that's a good question. So kind of think about them in different buckets. So we have our seasoned CNAs that have already been working for you for 6 months or more, that are the rock stars of your community, that you want to do the onboarding for your new CNAs starting. Those are your mentors, and they're going to go through the mentor training. Then you have your CNAs that are hired at any time. Those new CNAs are going to be paired with a mentor that has already gone through the training, and your mentor, your CNA mentor, and your new CNA that's just starting off are going to be paired together. And they're paired in combination with the mentor champ working with the scheduler or the HR, whoever you coordinate with at your community for a new hire. The mentor and the new hire are going to be paired together. They're going to be onboarded with either 3 12-hour shifts or 4 8-hour shifts, whatever your community supports. And they're trained, or the new CNA is trained by the mentor, same way that you already onboard your CNAs right now. It's just that your CNAs that are doing the onboarding for your new hires, they haven't been trained potentially how to onboard a new CNA. This is a formal training on how to train and support the new hire. During those 3 12-hour shifts or the 4 8-hour shifts, as many competencies as can be completed during their time together, try to get done. Whatever's not done with that shadowing time, within the next 30 days, the mentor and the mentee need to complete the competencies. So kind of think of it as 2 different buckets. Does that make sense?
Yeah, so then it means that you conduct this training, you have a whole cohort of new mentors,
Yep.
and then it's like you have a pool
Yep.
from which you can draw
Yep.
as these new CNAs come on board. So it's not like,
Yes.
okay, you train 5 mentors in anticipation for 5 CNAs to start the
Right.
next week. It's you're already prepared,
Mhm.
you've got your pool of trained mentors,
Mhm.
and then whenever you need to start a new CNA, you're already ready with
Yes.
your pool of mentors.
Yes, really nice way to put it.
And like, how long, like, do you recommend that, like say you did it in June and then the new trainee doesn't start until December? Like, is there a certain amount of time that you would recommend that new CNA start, like basically implement the mentoring relationship from the time that they're trained to the time that they're actually doing the mentorship? Is it important that it happens right away, or it can? Okay.
No, it could be at any time. Like you said, so once your CNA mentors have been trained, this is a one-time training. They never have to go through mentor training again. They are in a pool of CNA mentors that can now mentor a new CNA anytime that they start, anytime a new CNA starts. So for us, let's say we have 20 mentors and we have one in our pool. We have one CNA that's starting. We try to pair that mentor, one of our 20 mentors in our pool, with this one CNA, and we try to pair it so that they're working the same shift that they're both hired for, the same neighborhood that they're both hired for, so that they can learn what they need to perform to be successful at their job. The new CNAs learning the skills to be successful at their new job. So yeah.
So when you're selecting your pool of mentors that you're going to train, is it important to have a representative from each shift and each neighborhood so that you're prepared no matter where that CNA starts? There's a mentor available that's already trained, who can be paired up. But like you were saying before, once the mentor champion has this knowledge, they are then empowered to do this training whenever the need arises. So even if they don't have that strong pool already set up, they can just do it whenever it's needed.
Yes.
You know, once that vacancy is known, even like if you know that there's a new vacancy on that shift, then okay, we're going to need to have a new person start. So that means we need to find a mentor from this shift to be that new person's mentor.
Yes, and that's why, so for us, we hold training, mentor training every January and every July, because we know we have attrition of mentors, right? We have mentors that quit, and now we need new mentors. So this is a continuing process. This isn't a one and done training at your community. That's why you have all the tools. You have the PowerPoint so that you can train new mentors at any time based on attrition.
Great. So I'm not seeing any questions coming in, but I do encourage everybody on the call, if you've got anything that you would like to, have Natalie expand upon, or just, ask us to discuss a certain topic, we're happy to do that. One other question that came to mind, when you were talking about the paperwork, like there's like a checklist and all the steps to the competency. During the mentor training, are you completing those forms for each of the mentors? So then in effect, you've got the paperwork, you've got the file, so to say, on the competencies for each of those mentors in addition.
Yes. Yes. So we do the skills training in the afternoon with all of our new CNA mentors so that they have a complete competency file for survey readiness.
Excellent. And then so for the CNAs, so like we're doing that. So everybody on the call right now is going to be doing this particular model like right away. So how would you recommend they start? So like they're going to have their first crop of mentors, and then there's going to be the pool of existing CNAs that are not selected as mentors. How do we make sure that that pool of CNAs that are not selected as mentors has that complete competency file?
Yeah, that is the beauty of this program. Also, you now will have, let's say, I'm just using us as an example. Let's say I have 20 mentors in my pool, right? So maybe annually let me put it a different way. I have 20 mentors in my pool that have completed all the competencies and they know how to teach the competencies. Select a date for competency skills lab for all of your CNAs within your neighborhoods, your organization, for a competency skills day. Set up all of your stations like you did during mentor training with a copy of all the competencies, and have your 20 mentors teach the skills to the remaining CNAs that you have on staff. That way you can get everyone's file up to date with all the competencies and be survey ready.
Right. And I could see also how that would be good practice for the mentors to practice the new teaching skills that they just learned on somebody who's not a total newbie, and maybe get the feedback from that more experienced CNA about, okay, so how did I do? Did I explain all that? Do you understand?
Yeah.
Was that clear? So yeah, so that's a really good plan. I again, this program not only is a good retention and onboarding tool, but it's also a survey tool.
Oh my
as well.
gosh, yes.
So
And yeah, and for litigation or state survey questions. You know, did somebody perform that training? You know, if you have an adverse event, why, yes, they did. Here's the competency. It's signed. There are so many benefits to having your mentors trained to be able to train others within the community.
excellent.
Yeah.
Well, thank you so much. I don't see any other questions popping up. So, but if anybody thinks of a question after we finish up, you've got Pat and Natalie's email addresses. I know, Natalie, you had asked in the previous sessions that we've had that people email both you and Pat so you can respond as a team and, you know, to kind of tag team to make sure everybody gets their questions answered timely.
Yes.
But yeah, we're very excited to have everybody back tomorrow morning at 8 a.m. And we're going to be doing that 4-hour train the trainer training.
Perfect.
Okay. Well, thank you, Natalie. And thank you everyone who's attended. We'll see you back here tomorrow.
Perfect. Thank you. Have a great afternoon, everyone.
Thanks.